In any wilderness survival situation, knowing how to assess injuries quickly can be the difference between life and death. That's where the ABCDE method comes in, a primary survey technique used by wilderness first responders to identify and prioritize life-threatening conditions. Whether you're on a hike or caught in an outdoor emergency, understanding the basics of airway, breathing, circulation, disability, and exposure ensures you're prepared for immediate action. Stick with me as we break down each of these steps. Your first priority is to check the victim's airway. If their airway is blocked by blood, vomit, or other obstructions, they won't be able to breathe, and this is an immediate danger. To clear it, you might have to tilt their head back slightly or perform a jaw thrust maneuver. If the airway is compromised, getting it open is the first step to ensuring survival. Even a minor blockage can be fatal if not addressed quickly. Once the airway is clear, ensure that the person is breathing. Observe their chest movements. Are they rising and falling? Listen for breath sounds and feel for airflow from their mouth or nose. If breathing is shallow or non-existent, it's time to act fast. Rescue breathing can help. Give 2 rescue breaths and monitor if their chest rises. In wilderness situations, this is crucial because immediate medical help may not be available. Having a basic understanding of rescue breathing could save a life. Now it's time to check circulation. Start by feeling for a pulse. If there's no pulse, begin CPR right away. Remember, time is of the essence here. Circulation isn't just about the heart. It also includes blood loss. Look for signs of major bleeding and stop at using a tourniquet or bandaging. Apply direct pressure to any wounds. If you don't control severe bleeding, the person could go into shock or lose too much blood, both of which are life-threatening in a survival situation. Next, evaluate the victim for any disability or neurological damage. Can they move their limbs? Are they responsive? Can they follow simple commands? If the person shows signs of spinal injury, make sure not to move them unless absolutely necessary, as this could cause further harm. Always stabilize the head and neck if a spinal injury is suspected. This step might seem less urgent, but it's essential for preventing long-term injury and ensuring the person's overall safety. Finally, exposure is the last component of the ABCDE survey. In the wilderness, environmental factors like cold, heat, rain, or snow can pose a significant threat to survival. Once the immediate medical concerns are addressed, protect the victim from the elements. Cover them with a blanket, jacket, or any available material to keep them warm, or if in a hot environment, ensure they're in a shaded area and hydrated. Wilderness exposure can quickly lead to hypothermia or heat stroke, so it's crucial to act fast. To wrap it up, the ABCD method, airway, breathing, circulation, disability, and exposure, is a systematic way to prioritize life-saving actions in an emergency. First, check the airway, then assess their breathing and circulation. Look for any signs of disability or spinal injury. And finally, protect them from exposure to the environment. These steps can drastically improve your chances of keeping yourself or someone else alive until help arrives. If you're serious about survival, start practicing the ABCD method today. Whether you're an experienced adventurer or a weekend hiker, being prepared could make all the difference. Hit the subscribe button to learn more essential survival tips and techniques that could save lives. Stay safe out there and always be ready for the unexpected.